Happy Friday and happy National Volunteer Week. This is Dr. G at the Heart of Healthcare, and this is season 2, episode 3 of the podcast. I'm so excited to be here. I have a special guest, Tracy Nordbak. I'm going to introduce her in a second. She had a really important job as the director of volunteer services at California Hospital in Los Angeles. And I know her from when I was a volunteer as a pre-med student at Downey Regional Medical Center. I pulled out the shirt for everyone. So welcome to the podcast, Tracy.
Great to be here. I pulled out my volunteer coffee mug.
Oh, I still have mine too. And I'm going to find a picture from the party, the Christmas party, and I'm going to post it with this video. So you guys look to see Dr. G back before I was a doctor back in the day, a little bit younger. Anyway, so we just want to celebrate volunteers in the country. I used to volunteer, do a lot of things, for PTA when I was a stay-at-home mom, soccer mom, football mom, all that stuff. And I still volunteer on nonprofit boards. So we all have a role to play in building the community and supporting the community. Mm-hmm. And so I just want to celebrate the leaders. So the theme this year is celebrate service, and it's an opportunity to shine a light on the people and causes that inspire us to serve. And I also have a little declaration from the White House for all the volunteers because we keep this country going. And so let's just jump into your career. So you're retired now. Tell me about that.
Yeah, I retired in 2022, the end of 2022. After having an amazing career I felt so blessed to do the work I did because it was such an inspiration because of working with people like you, Kishana. All of the people, and you said it when you were talking about you volunteered as a PTA mom and as a Little League mom and all this stuff. I did the same thing. I grew up volunteering. And I think that so many people out there in our nation aren't even aware of the fact that because they don't have a volunteer shirt,
like me,
they don't consider themselves a volunteer. But indeed, we are helping in so many ways. When you help your neighbors, you help your community. It doesn't have to be this official, but give yourself a pat on the back and say thanks to all the other people in your life that are doing those little things to contribute and make our world, and I mean our world, our neighborhood, the world we inhabit, a better place.
That's fantastic. Now, how did you find yourself in the leadership role of running volunteer programs? Could you tell us a little bit about that?
Sure. I actually was a stay-at-home mom for many, many years. And then it was time to, move into the work world. And I lived in Downey, and Downey happened to have a volunteer or a position open at the hospital. Once I started there in a part-time capacity, the volunteer role opened up. And because I'd been such an advocate for volunteering, I applied for that job and I got it. I worked there for about 10 years. And then I moved on to California Hospital in downtown Los Angeles. And as the director of that facility, they had a volunteer program that went inactive, and they were resurrecting the volunteer program.
Awesome.
So I got into the leadership role of, managing volunteers. I thought, it's funny. I thought as a volunteer, I would love to work in that capacity. It's entirely different to manage volunteers than it is to volunteer. But I still loved just the essence of what makes people want to contribute. Priceless.
It is. And I can remember when we were in Downey, I would take a shift on Christmas. I was a stay-at-home mom, and then I became a pre-med student. And once my kids opened their gifts and all that stuff, we're just kind of sitting around. But I thought, there's someone who's going to be in the emergency room. Yes. Maybe I can give them a blanket. Maybe I can help the nurse out and make it better to be there. That's kind of different thinking, but I guess that's how all of us healthcare workers are. We're there to make a difference.
Absolutely. I actually got messages from people through the years that people would be like, oh my gosh, it was 4th of July and a volunteer brought a magazine to me. So people just really appreciate the presence. And there is something special about knowing boy, this is a special day for that person too. But they made a point of being here to help me.
Yes.
Massively impactful.
Oh, oh, wonderful. Yeah. So when we were preparing for this episode and catching up, I was talking to Tracy about our last week podcast about end of life doulas and death doulas. And you mentioned, how in your volunteer program and other ones around, there's a program, No One Dies Alone. And for folks in the hospital, and that got me really excited because end of life care, is my passion. So tell us about that journey and what's entailing, what's entailed in that.
What struck me when you mentioned the death doula was that what an important role that is, because I had a need at California Hospital. We served an underserved population. We served a lot of homeless people, a lot of mentally ill people, people that truly were going to be dying alone. And so to be able to have somebody that would just be willing to go and sit and have the, internal strength and desire to do that, because that's an extraordinary gift, was something I really worked hard to try and do for our patients. I knew so many volunteer directors in the greater LA area and Orange County area that had vibrant No One Dies Alone programs, but their volunteers didn't have anything to do because most people really don't die alone. Mm-hmm. They have a loved one, they have family, they have friends, they have neighbors, they have people that fill their lives. Some of the people that we had in our hospital really didn't have anyone. So it was so important. But I was thinking how important it would be for one of the more, a volunteer or a program in a more affluent area where people don't die alone. Every once in a while, somebody would die alone. Somebody, maybe they're from New York and their kids are all away. There are people that have moved and relocated, and they're basically not alone, but they don't have people to be with them that in those really difficult times. Somebody that is trained and desires to be there with another human being during that time. What an amazing gift, and what a super important position and role to fill in someone's life. So important. Yeah.
I agree. And, my daughter, she volunteers actually in hospice care. Mm-hmm. And she, at first she was a little apprehensive about getting into that. Sure. Mm-hmm. But I told her, you may do a puzzle with someone, you may, just play a game with them or offload something from the caregiver. And so that's so important. And I know you too have legacy volunteerism in your family, and your mom is the one who inspired you. Tell us about her.
Well, so my mom was she was a volunteer throughout our whole lives, volunteering, like you said, a PTA, and I was a Job's daughter. She was Joby. She sat on the council for Job's Daughters. And my brother was an athlete, she was part of those, all the things that made that whole thing work. So she was a full-time employer. She worked for the County of Los Angeles, and yet she still made a point of volunteering. So I grew up with that sort of ethos of volunteering. I spent a lot of time in my youth volunteering. And I was actually a hospice volunteer. I can relate to your daughter's apprehension, because when I was in college at USC, fight on, can't let that go.
I'll give you a pass on that. Go Bruins.
Thank you. I know, exactly. We can be combative about that.
I love it. I love it.
But I volunteered. I was a biology major. I wanted to be in healthcare, and I volunteered to be a hospice volunteer because I felt like it was a great way of just reaching out. And I had a total affection and affinity for gerontology. Thank goodness, because now here I am. But I was very nervous about doing that. But it was still a really enriching experience for me. But the thing is that's so special when you called me about this is my mom. So my mom was a go-getter. she was such like an active person, wanting to be busy all the time. So when she retired during the downturn in the economy in like the 90s. She would never have retired. She would have worked until the day she died. But that was just what happened. So anyway, she just became this avid volunteer. She volunteered for hospice, and she became, what was extraordinary about her is she lost patients, because that's the nature of hospice, but she carried on volunteering with their families. So whether it was the spouse or the children of one of the people that had passed away, she went and bought their groceries for them. She would, take some of these older folks, they couldn't drive, so she'd take their pets to get like their veterinary care. So she just stayed connected to those human beings, which is really what, volunteering, but in particular, hospice care. It's about caring for another human being, in just the gift of presence. I went to a thing on my when I was actively working, and it was at the City of Hope, and a nun came and spoke, and she talked about a passage that said, "Sit behind me on my bench." And that's all that the person wanted. They were alone and frightened, and they felt isolated. And so the gift they wanted was just somebody to come and sit behind me or sit beside me. And that's what volunteers can do, is just be a human presence. Priceless, really a beautiful thing.
I love it. And that's pointing me back to this proclamation, from the White House. It says, America's volunteers embody the core values that define our nation: an optimism that is tested yet resolute, a courage that digs deep when we need it most, and an unshakable faith in one another, our nation, and the future we can build together.
Right.
During National Volunteer Week, we celebrate the millions of selfless Americans who keep faith in all of us and give their time, service, and hearts to make sure no one is left behind. Just so wonderful.
Oh, no. Yeah.
Yeah. And that's what your mom did by, the caregivers. Once they have to shift from being an end of life caregiver and that person dies on hospice, they are grieving, they need that support. And what an angel for her to stay with them and support them even after that.
Right. And to see that, I mean, your point about being a hospice volunteer, I know when I was volunteering, I had a family, it was an older couple, and the husband passed away. And I met him, but he didn't know. He was already so much at end of life. But I helped her in so many ways. I helped her go to the bank. I helped her do the details of death. And if that was the role I could play to assist her, then that wasn't what I had assumed and expected when I was a pre-healthcare volunteer or student, but it was how I could meet a need. And that is a beautiful thing. I salute you for celebrating the volunteers and what they're doing, and especially the volunteers that are working with hospice patients, because it does call on us. Somebody has to have a special something to be able to give that.
Yeah. And so thank you for that. And we do have to hold a special place. So the valuable resource today is actually going to be a link to the Hospice Foundation of America, and where you listeners can find information about volunteerism. And I want to tell you a tidbit about hospice volunteer programs. They actually embody like 5% of the total patient care, and hospice agencies are required to show how they're well trained, and they have defined roles that could be either administrative or direct patient care. And they really help with cost savings in hospice agencies. They're under the Medicare benefits, so it's only a certain amount. So the money they can save by having these special people to sit in with folks, of course, not doing anything weird for those of you who are scared. But it really, really helps out with an important sacred time in life, and the healthcare that is the heart of healthcare, in my opinion.
Yes. Yeah. So much of it is like just respite care for the people that are really dealing with the hard work of, caring for people. And that reminds me, my grandma was a hospice patient, And I wonder, my mom has passed away, but I wonder if that was part of the impetus of her becoming a hospice volunteer. I never really, I mean, we talked about it because I had done it, but we didn't talk about that. But yeah, and what a blessing that was for our whole family. My grandma was able to be home, and yet she was able to be cared for. Yeah.
Fantastic. Well, I'm so glad that I could be with my volunteer
Yeah.
boss to celebrate National Volunteer Week.
Right.
I just really enjoyed being a part of that program with you. And I thank you for everything you did to make healthcare better in your before you retired.
Well, thank you. And this has been fun because I am retired and I'm loving retirement, but it is kind of nice to look back and think about all those amazing people and those moments that are really, really special and what made me absolutely love my career. So thank you. Thank you, Kashana. And thank you to all the people that might see this that are volunteering for what you're doing. It's really a priceless gift for all of us.
Fantastic. Well, we salute you today, and we're going to go ahead and sign out of episode 3, season 2 of Dr. G at the Heart of Healthcare. Peace. Peace. That's not a fight on. That's a piece.
Oh, that's peace. I can do both.
All right. We're going to have fun this football season. Take care. Bye now.
Thank you. Bye.